I want to invite Dr. Ravi to talk to us for some time. So he is a gastroenterologist and a liver specialist from Midwest. I forgot the
Cincinnati.
Cincinnati. Okay. And he's been doing the Wednesdays with Rajan Essential Homeopathy course. He studied books on homeopathy, and he says that, you know, modern medicine has a lot of limitations, and I want to look for other avenues. And definitely one of the things that's kind of missing in homeopathy is valid, acceptable scientific research. So that's where he has volunteered to help us to set up a research where we could do kind of acceptable research. And I really think that's what homeopathy
We need
We
that.
need that.
Yeah.
otherwise we are not considered
Acceptable.
Science work, yeah.
There was somebody, Indian
So
doctor.
I would like him to speak a little bit about his ideas and inspire us a little bit.
First of all, is there any regular allopathic doctor in the audience? No. So then I think it's very useful to tell you a perspective of I don't know what it's called, mainstream or maybe allopathic doctor, and see how homeopathy is perceived and how we can have an idea of how people think outside the homeopathy world about homeopathy. So I have a little bit of background. I am a gastroenterologist. I trained in India, my basic training and postgraduate training here, and then I went to England, spent 3 years. I have my membership in Royal College of Physicians, and then I went to the United States, did my gastroenterology fellowship and a hepatology, a transplant. I'm a transplant liver specialist. Okay. Hepatology, and I've been practicing for almost 13, 14 years after training, for a really long training, repetitive, but still. So I have a very good idea of how medicine is practiced in different countries. And the more and more I practice, the more and more specialized I get, the more I'm convinced of limitations of allopathic mainstream medicine. Actually, I think there are limitations for every system of medicine. There is no one system which works completely, in my opinion, as of now, anyway. So I was really looking to find something. I've been looking for a while, actually. So maybe for 4 or 5 or 6 years. Initially, I was interested in stress relief techniques such as meditation, mindfulness, which I still work. I actually bought a bunch of books and I give to my patients to use them. And there is a system of Indian spirituality called Vedanta. It's a non-duality thing. So we're very interested, me and my wife. So we've been into that for a while. So we haven't, and that can be extrapolated into, so to speak, being in the moment, which is negating the time. That helps a lot, and that's what even a couple of patients said that. That's very useful. So that we know helps pretty much every disease, organic, including people who had liver transplants, including who had end-stage liver disease with decompensation, ready for transplant. Even they are helped by techniques which are, so to speak, forget the past. Don't carry the baggage or don't worry about the future. These kind of things. So on top of this, but that is very hard to do, very hard to teach, and different faiths have different. That's the reason I actually studied different religions to see how they, like Sufism or Gnosticism, etc., and then taught them. But clearly, that's not an answer. Something which actually helps heal patients rather than treat patients. We treat patients every day. I don't think we heal anybody, actually, to be fair. And more, I see older patients who are on 15, 20 medications. There's really no healing involved. We kind of there's a toy in the US. I don't know if you have it here or not. I don't think I played it when I was young here, where you close one, another thing pops up. You close one, another thing pops up. So that's what we do pretty much in most mainstream medicine. We treat a problem, another thing comes up because we're not really addressing the core. So when I was looking at this, then homeopathy was something which I came across. I've known a lot of people, homeopaths, when I was here, and I also, unfortunately, this is my perspective, correct me if I'm wrong, 99% of the homeopaths I've known in India are really, I don't even know what they're practicing. honestly. So they give medications, they give 3 or 4 combination medications here and there, and then they keep treating. I don't think this system. When I started reading about homeopathy, and I realized that this is not what most people I know are practicing. So I was trying to find classical homeopathy, figure out how it exactly is done. So I started reading a bunch of stuff, and then I looked at some names. Initially, I actually seeked out people who are medical doctors and who also did homeopathy. And I actually communicated with this is Dr. Philip Bailey in Australia. And then there's another stopped practicing. He wrote a couple of books also. No, it's he even has a component in one of these softwares. It'll come to me.
Sure. Vitulkas.
Vitulkas is not a doctor, right? Medical doctor.
Look
Luke Shepherd, yeah.
Yes.
So and I bought a bunch of the books and read from his point of view, and then I communicated with him. So to figure out what it is, how it is done. Then I realized that there are so many different. Although classical homeopathy seems to be one. This is from an outside perspective. Clearly, you know better in how. But there's so many people treating differently. So many people are understanding it differently. So I didn't really get a grasp of how it should be done. So then I heard about Dr. Vitulkas, and then I read his books, and they were really good, and the concept was really good. But then I was supposed to go to Greece, and something happened, I couldn't go to do the course, so I never actually went there. Then I started reading Dr. Shankar's books, and I was fascinated because it looked like the background is Indian, so it's a little there's a commonality there. The second thing is that I felt that he thinks the way I think in my daily practice too. So the thought process similarity was there. So that was that creative. I think you are all extremely lucky to spend time here. I think it's spectacular. So that helped me a lot. So I read a lot of his books, and then I felt that there is my knowledge in homeopathy was very patchy. Meaning I was reading this book here, that book here, different person was completely getting confusing. So that's why I enrolled in Essential Homeopathy course. That's the only course I could get where I can get a structured thing. And it's been very useful. I listen to that in my car. I convert them to MP3s and put it in the car. So when I'm driving to work, that's what I listen. So I guess my point is, then I realized, it looks like the concept is fascinating. I know anecdotally it works. I know, and I've actually dabbled in my family members after reading to treat some stuff, and it worked really well. But not to any reproducible extent. So, and I read I liked one of your anecdotes in one of your Essential Homeopathy videos that it's like shooting into the sky every 5 minutes, and sometimes a bird flies, and then you hit it, and it's spectacularly effective, and so it's by chance or not. When it works like magic. But the question is, it's not. I didn't feel it was reproducible in most of the situations. Then I started looking at evidence. And one of my nephrology friends in Ohio State, in Columbus, he sent me a couple of books which says one snake oil, and there are a couple of books which are highly critical of homeopathy. And then he said, you're just completely wasting your time. This is how I can't believe after so much I've known you for so long, why are you doing this? Anyway, that's this is the standard thing everybody gets. So when I started reading this, and then I realized that there is not much of evidence, so to speak, meaning there are a lot of case reports. That when we do a follow-up, there are beautiful examples of people healing, people improving, not requiring any medications. But that's not something you can sell, or you can tell somebody that my experience is my experience. I cannot convince you of my experience unless you experience yourself. And for you to try that, I have to show some concrete, undeniable, reproducible evidence. So that evidence is completely lacking in my research so far. Clearly, I haven't looked enough. So I spoke with all these people, with the names I mentioned, and including Dr. Vitulkas' group, and they actually hired somebody for research. They're trying to do something like that also. I've not done that yet. But the point is, there is no research. After so much of presence of homeopathy in it actually spectacular field, there's not enough reproducible research where I can actually tell somebody in US, my patient, say, you know what, you'll be helped by homeopathy. I've actually done that in the past few months after I've learned a lot more. When I know that this patient would be helped by homeopathy, I didn't treat, but I referred them to people who do Skype sessions, because it's one thing they can do. So that's what I've referred. In fact, I referred somebody's going to India to come get an appointment here. But before I do that, clearly I need to know, I need to understand, I need to, that's the reason I'm doing all this. It's almost like I don't intend necessarily to treat. anyone professionally, but I want to understand before I treat any research, do any research on it. So I guess the bottom line is that we need a lot of research. We need some research done in the methodologies of the Western modern medicine world, which and those designs, what I was talking about this morning, and we can design them. There are some chronic conditions. Obviously, there are challenges. Part of it is being the fact that it is individualized. It needs more. To put it, I'm short of putting it any other way. Homeopathy is efficacy depends much more on the homeopath than the medication, I think. So, and that is kind of different from allopathy. Allopathy, pretty much you do some basic stuff, it'll work somewhat. So, based on literature. So that makes it inherently harder, although better. That also is the good part of it is that is why it works. That's why it heals. But it's also harder to do. So we have to find methodology, brainstorming to see some conditions where we can treat with homeopathy and blind them and randomize, not necessarily blind them, but randomize them and see one group gets homeopathic medication plus maybe allopathy and then allopathy alone. Because it's very hard to not give allopathic medication and treat just with homeopathy where there is no evidence to treat. It is impossible, at least in the Western world, to say that this is what I'm going to treat, I'm not going to use allopathic medication. So this is the kind of design things we have to identify some situations which are chronic, where there's no easy medication in the Western therapy, and in situations where homeopathy works really well. So these are the things which we can start off with, and then maybe once we get a foothold and a couple of good quality studies establishing the efficacy in any disease, doesn't matter. Any disease, one disease we have a good quality study saying it works, then there's a foothold of legitimacy for homeopathy. Then we can extend it to other disorders where we can do more research. And that is what I want to be a part of if I can, but I'm still in the process of learning it. So, but in the meantime, we can actually set up something to understand, to do it better. I don't know if you guys agree with me or if there's any other ideas. So that is in short the goal of my visit here.